Hi, my name is Apipol, and I am the academic coordinator from the International Academic Forum, and today I am at the ACE-ID ACP Asian 2024 conference here in Tokyo, Japan. And I have with me Robert E. Claar. Robert, would you introduce yourself for us, please?
Thanks very much. I'm Rob Claar. Please call me Rob.
Thank you.
And I'm the CEO of HekaBio. We are an in-licensing bio-venture here in Japan. We scan the horizon for all great innovations, medical devices, pharmaceuticals that can be used in an acute hospital setting in Japan for the benefit of clinical outcomes as well as health economic outcomes for Japan. So we're very much involved in the bringing more innovations and getting them into the hands of doctors and patients as quickly as possible here.
And Rob here gave a keynote presentation titled Japan as a Role Model for Ultra-Aging Societies, Innovation and Sustainability in Universal Access Healthcare. Right. So we're talking about ultra-aging society. What is the current situation like in Japan or in the world today in general?
So for sure, we see, we call Japan the ultra-aging society because if you look at the base definition of 65 and over population, Japan has 30% of its population in that band right now. Of G7 countries, the next closest one is Italy at 24%. So, and other ones, for example, Korea is very famous for having such a low birth rate, and its rate of becoming an ultra-aging society is actually the fastest. But they have a ways to catch up until they get to that Japan level at the 30%, and Japan's going to be growing beyond 30% as we go. So what we think is that, Japan is a universal access, universal coverage healthcare, national healthcare system that operates under a tax-paid it's actually, so when you work in Japan, as part of your salary, you'll be paying into the healthcare system. Right. You'll also be paying into the long-term care system. So both of those budgets then are used to pay for the delivery of healthcare. With the declining population overall, declining working population, we have a limited budget. And this is the concern, but Japan has a great ability to deliver great health care across the board within that universal access healthcare system, so that Japan has the best life expectancy and healthy life expectancy, as you saw. So what we want to see is that Japan can continue that leadership there, not to be better than other countries, of course, but to show the way that a great healthcare system can continue to deliver well for its population and show the ways that other countries could also follow that lead, because Japan is going to have a bit of a head start on how to deal with the ultra-aging society.
What do you think could be the case that the thing that Japan can learn from other countries, and what other countries can learn from the Japanese case in preparation of stepping into the ultra-aging society?
Yeah, thank you. So I think there's a few things that Japan can learn from the rest of the world, and I think really digitization, IT infrastructure, and the ability to roll out more technologies that help with the analysis of data. Because Japan's healthcare data access is very limited actually right now. Even though it's a single-payer system, it's hospital by hospital management, right. And so having that more accessible, searchable, analyzable by many people, and having each individual with access to his or her own healthcare data is going to be quite a good benefit. Right. Japan's very much behind on that, and we would like to see that improved. We would also like to see improvement of particular software as a medical device solutions that may help to keep people, for example, children, or for example, elderly people with chronic disease, home monitoring devices that could keep people out of the hospital system and save cost. Right. But right now, Japan has a hard time coming up with the appropriate reimbursement price to pay for that type of system. So Japan could learn from parts of the rest of the world that have more experience in reimbursing those types of home solutions and monitoring solutions. Things that the rest of the world can learn from Japan. Specifically, we would say it's a bit hard since the system is really what defines the universal access.
Right.
But we would say that Japan has a few things that are very good for everywhere around the world, not just the developed countries that are moving into that ultra-aging band, but also the global south.
Right.
Japan does a wonderful job at preventative health care in the sense of, for example, one famous thing is the mother and child diary.
Right.
They have this mother-child diary, which has also actually been rolled out to certain countries around Asia as well. Japan is very proud of that because it's a diary and a documentation of everything associated with the mother and baby health. And they've shown that has had a great impact on childhood disease prevention and early warning identification, etc. So
Right.
that's been a great tool,
Right.
and that learning and that expertise has been rolled out to other countries as well. I'm not sure if this is good or bad, but one other aspect of the Japanese healthcare system is that Japan has typically not wanted to pay for preventative health care. Now, normally we would say that that's a very bad idea, but they've pushed it outside of the national healthcare system and onto employers.
Right.
So the employers need to pay for preventative health care or annual checkups for all of their employees. Now, annual checkups are a great way for people to have early identification of a serious illness. So this is very important, and that preventative aspect, Japan has sort of taken a side road to enabling and requiring that. But I think all countries should also have some very serious measures in place for early identification of serious disease, because we know that the biggest drivers of healthcare costs are going to be those chronic diseases once they develop. For example, diabetes, right? COPD. So smoking cessation so that people don't develop lung disease. COPD is a huge cost to any healthcare system.
Right.
And then another one will be heart failure. Now, heart failure is difficult to prevent in terms of lifestyle choices, etc. But if you're getting an early warning for heart failure, and you're able to identify that outside of the hospital context and then bring that into an early warning system and save money, then I think that would be a winning solution as well. Another one that a big driver of healthcare costs in Japan is that Japan does not have a lot of organ transplantation, so chronic kidney dialysis is a huge driver here, where the government has made a commitment to cover all of those costs, which is good. But perhaps Japan could also learn ways to somehow improve the number of transplantations that do go on to enable some of those people with chronic kidney disease to avoid having that dialysis and that cost. So these are difficult cultural aspects to get over, but one potential area of improvement.
Right, thank you. And from the business perspective, we talked about Japan as a more developed countries. From the business perspective, what is like the business opportunity in less developed countries?
So opportunities in other countries around the world. So here's my philosophy. I think that great healthcare delivery and devices, technologies should be available to everyone, anywhere in the world, no matter what. And so I don't want to be involved, which is what parts of this business are, which is only dealing with the very highest, most expensive innovations that are only affordable by the very rich. Right. This, to me, is much less interesting than bringing the available technology to everyone. So in Japan, we're spoiled from that sense because it's not a rich versus poor healthcare system. Everybody is included in the universal coverage. Now, we believe that, for example, the portfolio that we're dealing with at my company, we believe we don't have any operations outside of Japan, but we believe that the portfolio we manage is also very relevant to many other countries. And we're going to begin focusing on outside of Japan in Asia. Coming soon. Right. So we hope to bring those technologies. I think, it's a matter, in our world, we're looking technology by technology. We're looking at those different solutions that could be very relevant for Japan, but then we're also taking that next mental step to see, okay, where else could we bring this? Because we know that there's a lot of patient benefit that's waiting to be realized.
What do you think the people or academics or students in the healthcare field could study more or research more in order to respond to today's ultra-aging society?
Thank you. I would like to see more collaboration between academics and healthcare providers and also companies in terms of developing and analyzing real-world evidence. So if you can imagine that, and this gets back to the healthcare data issue, right, and how hospitals are managing their own data, how that's coming into the entire overall healthcare system. If we have a perfect data set, then presumably we'll also have very good early warning systems for when is someone showing signs of developing a particular illness. If we could do that, then we might also identify that there are ways that someone could avoid the onset of that condition or that exacerbation. So, for example, there may be, even with things that you can barely even imagine could be preventable, right, but maybe there's a drug available for Alzheimer's disease, but if you look at the people who are on that treatment now and then go back over their experience, you may also identify another trigger many years earlier. And so what if there were an ability to intervene at an earlier stage with counseling or with other modifications that could impact that person's life? And this is a way that potentially could be life-saving, right, and also budget impact beneficial. So we would like to see things like that. The Alzheimer's case is perhaps an extreme one, but academic researchers and healthcare providers and businesses would all benefit from that type of collaboration, I feel.
Last but not least, a message for future IAFOR conference attendees.
Oh, well, this was a great conference, and it's my pleasure to have been invited and be able to speak at it. It was really great. The number of people, new people that I've met who have interests and research topics that are completely beyond anything that I've ever thought about is really mind-opening for me. So I encourage any attendee of an IAFOR event to come with an open mind and meet people and enjoy the discussion and the interaction.